On. All right, go ahead, Lynette.
Good morning. I'm Lynette Maselli, State Director of Protect Our Care, West Virginia. Thanks for joining us today on what is the 56th anniversary of Medicaid and Medicare. We have a great lineup of speakers, and I want to thank each of them for taking the time to join us here today. Seniors are at the center of the drug pricing crisis. Nearly 9 in 10 Americans over the age of 65 take prescription medications, with many struggling with serious conditions such as diabetes, arthritis, and cancer. As many as 1 in 4 seniors, or more than 10 million seniors nationwide, struggle to afford prescription drugs, with higher rates among more vulnerable groups, including low-income seniors, people of color, and those in poor health. It is unconscionable that seniors and older adults in this country are forced to make impossible choices between purchasing essential medications and buying food or paying for rent. Yet every day, drug companies continue to profit off seniors. Drug makers are raking in record profits and spending millions on lobbying efforts to block reform while continuing to hike the prices of life-saving medications. A recent analysis from the Kaiser Family Foundation found that half of all drugs covered by Medicare Part D had price increases averaging 3.5 times the rate of inflation between 2018 and 2019. This translates to hundreds, if not thousands, in out-of-pocket costs for patients, and it's simply unworkable for seniors. Research shows that even a modest increase in out-of-pocket costs can have deadly consequences for patients who are forced to skip doses or forego medications altogether due to rising costs. Joining us now is Kathleen Stoll, Policy Director at West Virginians for Affordable Healthcare. Kat, many Americans, both uninsured and those with health insurance, face unaffordable high prescription drug costs, but it's often worse for Medicare patients.
That's right, Lynette, and thank you. This is a serious topic, but I just want to share my happy birthday crown that I'm wearing all day today to celebrate that 56th birthday of Medicaid and Medicare. I'll skip blowing my horn, my little party horn this time, Lynette. But yeah, I want to take a second and explain how Medicare works, because if you're not on Medicare, it's really confusing. And even if you are on Medicare, it can be very confusing. So to start with, if you're on Medicare and you want to have prescription drug coverage, you've got to pay a premium for a Part D plan or a Medicare Advantage plan that has a prescription drug benefit. It's not necessarily part of the regular Medicare package. But then even after you pay that premium, the Medicare prescription drug coverage can be more caveats than coverage. There is nothing simple about understanding how it works. Now, most Medicare drug plans have a coverage gap. That's usually called the donut hole. And that means there's a temporary limit on what drug plans will cover for your drugs. So the coverage gap begins after you and your drug plan spent a certain amount for covered drugs. I'm not even going to give you all those numbers of spending, the dollars of spending. It's confusing enough to understand that your coverage changes as you spend more and more on prescription drugs. When you're in this coverage gap or donut hole and you're on Medicare, you pay 25% of the cost of prescription drugs. And then when you leave that coverage donut hole, you get a little bit more help. You get a 5% copay. So 25% and then a 5% copay. But here's the big kicker. Unlike private health insurance, Part D drug plans have absolutely no out-of-pocket caps on what you as a patient on Medicare have to spend on prescription drugs. So that can really add up. Even at that 5% level, if you need specialty drugs, for example, to treat cancer or some other serious condition, what you can spend out of pocket can be quite huge. And these prices for specialty drugs are soaring every year. Just one stat to illustrate that: for the 54 orally administered cancer drugs that many people need to take who are on Medicare, the prices between 2010 and 2018 went up 40%. And they average $168,000 for 1 year of treatment. So if you have cancer on Medicare, you can look at a lot of money coming out of your pocket. So as a result of these sort of high prices for specialty drugs and rising drug prices, there's like probably over about 1 million Part D drug plan enrollees who, even though they're paying that premium for prescription drug coverage, face about $3,000 to $4,000 in average annual out-of-pocket prescription drug costs. And if you're a patient with cancer on Medicare and you bought prescription drug coverage, you can easily spend $10,000 plus a year. So think about that. So think about a $10,000 a year plus bill for life-saving drugs against what the median income is for someone on Medicare, the average income for someone on Medicare. That's $26,000 a year. So you're coming close to spending half of the income that you have to survive on that prescription drug. So that's the picture in Medicare prescription drugs right now. So I don't think it's surprising that when we put a poll out to West Virginia specifically, West Virginia voters, it was a poll done by Global Strategy Group, and it was conducted for Families USA. We found that West Virginians definitely support doing something about this problem of Medicare prescription drugs. They support out-of-pocket spending caps and Medicare price negotiation. So I'm going to hit just a couple of these top lines. First of all, 93% of West Virginia voters ranked prescription drug costs as their top priority for congressional action. And 38% of those said it was their #1 priority. And more than a quarter of voters in West Virginia said they knew personally someone in their household who could not pay for their prescription drugs that were prescribed last year. That means that in this past year, at least about 387,000 West Virginia voters could not pay for medicine or drugs prescribed by their doctor. And in my mind, that's a health crisis. It's a health crisis the same way that COVID is and many other health crises that we face today. So with that in mind, nearly 1/5 of West Virginia voters said that they knew someone who had died in the past 5 years, died because they could not afford their medication. 1 in 5 voters know someone who died because they can't pay for their drugs. When you add all that together, you find out that the overwhelming majority, 87% of West Virginia's voters, support requiring drug companies to negotiate with Medicare for lower prescription drug prices for all Americans. There were only 5% of voters who had any concerns about that action. And there is overwhelming support across both parties, Democrats and Republicans. 93% of Democrats want to see prescription drug price negotiation. 88% of Republicans want it. So this is a bipartisan issue. And we saw from the poll that West Virginia voters want big reform, broad reform. They not only want Medicare to negotiate prescription drug prices for Medicare beneficiaries, but they want Medicare to negotiate drug prices for all Americans. And the support for that was very, very high in the poll. In addition, 4 out of 5 West Virginia voters, that'd be about 80%, support imposing tax penalties to ensure that all drug companies negotiate affordable prescription drug prices with Medicare. So they want the government to do it, and they want to make sure that the big pharma companies play. I just want to mention one other thing, that if you were to move forward in Congress with Medicare price negotiation, you could save the federal budget about $450 to $650 billion, that's billion with a B, dollars that could be invested in other health programs. And I think one of the ways it would be invested is a new vision and dental benefit in Medicare, something that is definitely needed. So the bottom line is that there's no question that West Virginia families and seniors are struggling every day to afford their prescription drugs. We see people dying because they can't afford their prescription drugs. That is clear. What this poll tells us is that it is very important that our congressional delegation support reforms to address the healthcare crisis of high prescription drugs. And this poll shows that not only is it important to save lives, but it's smart politics. It is a popular initiative that the voters in West Virginia will support. Thank you, Lynette. I'll wrap up.
Thanks so much, Kat. High drug prices demonstrate the urgent need to give Medicare the power to negotiate for lower drug prices. Earlier this year, House Democrats reintroduced the Lower Drug Costs Now Act, or H.R. 3. It's bold legislation to give Medicare the power to negotiate for lower drug costs. That's the single most effective measure to bring down drug prices. Not only does giving Medicare the power to negotiate help seniors at the pharmacy counter, it would also save the federal government, as Kat said, nearly $500 billion, which could be reinvested to strengthen healthcare for seniors and older adults. Joining us now is Sam Hickman, the Executive Director of the West Virginia chapter of the National Association of Social Workers. Sam, these savings could help lower premiums. They could expand coverage, establish an out-of-pocket cap for drug costs, and strengthen Medicare benefits to include, as Kat said, hearing, vision, and dental. As the nation continues recovering from the coronavirus pandemic, ensuring access to affordable health care and specifically prescription drugs has never been more critical. Sam?
Thank you, Lynette. That's absolutely right. And I want to underscore the magnitude of the problem, particularly in West Virginia. It's been a few years since I saw this study, but at the time, seniors in West Virginia were taking an average of about 16 different medications. So you compound this by every single medication, by every single Medicare recipient in West Virginia. But again, you are right, Lynette, and I really am fearful that we have not learned the primary lessons of this pandemic. What it is trying to teach us is that we're all in this together and that we have to depend on each other to do the right thing. For too long, drug companies have done the wrong thing by focusing on profits at the expense of care or even health. Drugs can't help you get better if you can't afford them. Profiteering at the expense of the health of our nation, especially the elderly, the infirm, and the disabled, it really should be a crime, and it's something we must do, we must bring under control. H.R. 3 begins to do this by allowing Medicare to negotiate drug prices, just like Medicaid, private insurers, and the Veterans Administration are already allowed to do. Did you know that the United States is one of only 2 countries in the world where direct-to-consumer marketing of prescription drugs is legal? Now, the pharmaceutical industry will tell you that these ads are meant to raise awareness, but the real goal is to create a demand for a drug the consumer might not even need or benefit from taking. It prompts them to ask their physicians for a specific medication. Isn't this backwards? Isn't this backwards from the way it should work? Shouldn't the doctor make an assessment and then prescribe what they think is best? Again, prescription drugs can't help people if you cannot afford them. But the pharmaceutical industry rewards its executives and its shareholders through lobbying, campaign donations, dark money campaigns, advertising, marketing, sales forces, and they are raking in money, particularly from Medicare. And this will not stop until Congress does something, and that has to happen now. So it's time to let Medicare negotiate drug prices, and we call on West Virginia's congressional delegation to do just that by passing H.R. 3. Thanks, Lynette.
Thanks so much, Sam. 1 in 4 adults over the age of 65 report difficulty affording their prescription drugs. Seniors most likely to experience difficulty are in poor health, have an annual household income of less than $30,000 a year, and or take at least 4 prescription medications a day. As I mentioned earlier, between 2018 and 19, 1,646 drugs covered by Medicare Part D experienced price increases averaging 3.5 times the rate of inflation. With the high cost of specialty medications, it should come as no surprise that 80% of prescriptions that seniors report struggling to afford are in fact for the treatment of somewhat serious or very serious health conditions. 1 million Medicare Part D beneficiaries spend more than Part D's catastrophic coverage threshold, paying an annual out-of-pocket average of about $3,200. Now, patients taking prescription drugs for treatments of cancer, multiple sclerosis, and even rheumatoid arthritis face some of the most extreme costs. Joining us now is Gary Zuckett, Executive Director of West Virginia Citizen Action Group. Gary, in 2019, 50% of Medicare recipients had incomes under $30,000 a year. With an average out-of-pocket cost for specialty medications surpassing $8,000, many seniors are faced with the impossible decision of filling their prescription drugs or paying for other basic needs. Gary?
Well, thank you, Lynette. Hearing our previous speakers, I could feel my own blood pressure rising as, in anger of the basic unfairness of the system that we have right now for our seniors. And this goes back a long way. I can remember Sam and I opposing the Medicare Part D coverage legislation when it was first introduced with that god-awful donut hole that Kat just mentioned. And correct me if I'm wrong, Kat, that donut hole was 100%. The original way it was dealt with was the seniors had to pay 100% of the cost of the drugs when they went into the donut hole, and it was the Affordable Care Act that reeled that back down to 25% that gave them some relief to that. But if also, and I believe that was also the legislation passed that prohibited Medicare from negotiating for lower drug prices. So that was a double whammy out of that legislation from the Bush administration back in the early 2000s. And we're still paying for it. If you look at the, Kat said that we would save $450 to $500 billion if we allowed Medicare to negotiate the way that the VA does. The Veterans Administration is allowed to negotiate. So for the last 20 years, basically, we've been paying an extra $400 to $500 billion of taxpayers' money going right into the drug companies' profits. And that's, it's no wonder that the pharmaceutical industry, the big pharma, they're the most profitable corporations on the planet right now. And they want to keep it that way. They have an army of lobbyists in DC and have spent, nearly $100 million already this year in lobbying with an army of lobbyists that I think outnumbers the number of congressional representatives from all the different states in DC. I have something here that I want to show. Excuse me here, and that it's an ad from the Charleston Gazette from last week, and it's the title is "Call Now and You Can Save Up to 84% Off Your Next Prescription with Us." And well, that made me take a look, and I looked at all these drugs, big list of drugs here, how much the actual cost. Then at the bottom, it says mailing address, Total Care, Winnipeg, Canada. So we have Canadian companies advertising here in Charleston that they can give people lower drug prices than they can get in this country. And that's unconscionable. It really is. We really need our senators and congressional representatives to step up and pass H.R. 3 and give our seniors relief, life-saving relief on their prescriptions that they so desperately need. Back to you, Lynette.
Thanks, Gary. H.R. 3 would not only allow Medicare to negotiate for lower drug prices, it would also save taxpayers money. Analysis from the Nonpartisan Congressional Budget Office and the CMS Office of the Actuary confirmed it would reduce negotiated drug prices by as much as 55%, saving patients an estimated $158 billion over the next few years and decreasing deficits by $456 billion. Despite countless promises over the last 4 years and under the previous administration to take action to lower drug prices, Congress blocked reform at every turn. Instead, they rewarded Big Pharma with massive tax breaks, and drug companies continue lining the pockets of their shareholders and CEOs while raising prices for everyday Americans and West Virginians. West Virginia's Senator Joe Manchin recently gave a big thumbs up to allowing Medicare to negotiate drug prices, recently telling reporters, quote, "This should have been done years ago. How in the heck that never was done doesn't make any sense at all." Now, fortunately, House Democrats reintroduced H.R. 3 earlier this year, giving Congress another opportunity to lower prescription drug costs and meet the demands of voters. As the nation continues to battle the COVID-19 pandemic, ensuring access to affordable healthcare and specifically prescription drugs has never been more critical, and the time to act is now. I'm going to be turning it over now to my colleague, Utsav, who will be opening up questions from the press. Utsav?
Sure. Thank you, Lynette. And thank you, Sam, Gary, and Kat for sharing your stories and your advocacy as well. For any press that are on the call, feel free to use the Q&A button that's at the bottom of your Zoom screen, and I will take any questions from there as they arrive. And anyone watching on the Facebook live stream as well, feel free to use the comment function there in order to submit your question. I do have one question in the meantime, and this is for anyone who wishes to take it. The question is, how has the pandemic served as a reminder to the public about the importance of investing in essential federal programs like Medicare to ensure that more people have access to affordable health care?
Kat, do you want to take the first stab at that? Anyone?
Let me unmute myself. I've got it. It's clear that when you have uninsured people and people who are underinsured, which is what we're talking about, you can have Medicare prescription drug coverage and still be underinsured. You are facing unaffordable out-of-pocket costs. When that happens, we all can't take care of each other. We can't get the drugs that we need if we become sick. And certainly COVID has shown what it means when we aren't in, as Sam put it, all in this together. So COVID has just driven home that when one of us is sick, we can all be sick. I just want to share a story, if I can, while we wait for other questions to come in. I've got a neighbor, and he is right at that median income of $26,000 for a senior in this country. And he has Medicare, and he has a Medicare Advantage plan. I won't tell you which one. And he is spending about $4,000 a year on prescription drugs. And all he has wrong with him, he's a healthy guy, he's 73, is some high blood pressure, a little high cholesterol, but nothing like cancer. Still spending $4,000 a year. That's not fair to him. That reduces his income to $22,000. But here's the kicker. Like many people in our age brackets, I'll put myself in the same, he had a toothache and he had to go to the dentist. And the news he got from the dentist was that he needed a dental bridge. And if you haven't checked into something like this recently, that is a $2,600 bill. So now he's got $4,000 in prescription drugs and another $2,600 for a dental bill. If we would move to prescription drug price negotiation in Medicare, save that $450 to $650 billion that is basically now pharma profits, CEOs making outrageous salaries working for pharmaceutical companies. If we cut some of that profit out of the system, we could reinvest it in vision, dental, and hearing for seniors like my neighbor. And then that would be life-changing for so many low-income West Virginians who are on Medicare and don't have a lot of supplemental income. So they're surviving on Social Security.
Thanks for sharing that, Kat. Utsav, do you have any other questions?
At this point, we don't have any other questions from the press, so I will turn it over to you, Lynette, to close us off.
Right. I just want to thank each of our speakers for joining us today, and once again reiterate the importance of the passage of HR 3 and allowing Medicare to negotiate drug prices for all Americans. We are so happy to read Senator Manchin's comments and are grateful that he supports us in this issue. And now it's time to act, get this done, pass HR 3, and help the people of the great state of West Virginia and millions of Americans nationwide. Again, thanks to everyone for joining us here today, and we'll talk again soon.
Thank you.
Thanks, everybody.
Bye-bye.